Thank you for your interest in the 2019-2020 Lucas County Community Health Assessment. My name is Emily Gensler and I am the project manager of the Lucas County Community Health Assessment, and I work for the Hospital Council of Northwest Ohio. If you started here to review the Lucas County adult data, I wanted to start off by mentioning there's an additional presentation posted to review the methodology of the community health assessment. For example, you'll find information regarding the design, analysis of data, and response rates. Additionally, this presentation is only focusing on the general adult population. Please check out the additional presentations to review the African American, Latino, youth, and child portions of the assessment. The full report can also be found on Healthy Lucas County's website at healthylucascounty.org. The first section we'll be reviewing from the health assessment is healthcare access. The sections underneath fall into this category within the health assessment. I want to mention that the full Lucas County Community Health Assessment is over 300 pages in length. We will only be touching on a fraction of each section to give you a general overview of what type of data that you'll find in the full health assessment. Starting with healthcare coverage, 92% of adults had health insurance, which left 8% uninsured in Lucas County. We ask why adults were without coverage, and you'll see the top 3 responses here at the bottom of the slide. The top reason adults reported being without healthcare coverage was because they lost their job or changed employers. The pie chart indicates sources of healthcare coverage for Lucas County adults. The top 3 sources in order were employer, Medicare, and Medicaid. You will also see options reported out as military, self-purchased, the marketplace, and also private insurance. The very first graph that we are reviewing in this presentation is reporting those who are uninsured in Lucas County. To explain this graph a little bit, you will see the very first bar as the 2020 percentage for Lucas County. As you move on to the right of the graph, you'll see the data broken down by gender, age, and income. I do want to note that when you are looking at the income bars, this is showing household income in the past year. We also break down the data by African American and Latino populations that were oversampled for the Lucas County Health Assessment. Just a note that we do have African American and Latino specific sections and presentations, but it is important to note in our overall graphs to show some disparities throughout the data. Lastly, as you look at the orange bars to the right of the graph, you'll see old Lucas County data from previous health assessments. This is why it's so important that we ask the same questions from year to year so that we can see the changes of the data throughout the years. At the very bottom of your slide, you'll see comparisons starting in 2007 for Lucas County. Additionally, we incorporate the national and state level comparisons to be able to look at Lucas County and how we were doing in comparison to Ohio and the United States. As you will see, Lucas County's uninsured rate is pretty similar to Ohio and lower than the national percentage. Moving on to the healthcare access and utilization section, you will see where adults reported visiting for healthcare services when they were sick or needed advice. The top responses were doctor's office, urgent care, and the emergency room. It's very interesting to see the changes in where people are going for healthcare services over the years. When looking at the last Lucas County Health Assessment in 2017, urgent care was at 23%. So we can see the popularity of urgent care growing. Additionally, telemedicine was only reported as 1% during the last assessment, which likely will continue to grow into the next assessment, with telemedicine being so popular during our current climate of COVID-19. The next slide is showing some newer questions that Lucas County started to ask during the last assessment, especially during our current climate of COVID-19. I know the issue of advanced care planning is even more important than ever. Overall, 26% of Lucas County adults had a living will. You can see decreases here for those with lower household incomes. 18% had a durable power of attorney, with quite the increase for those ages 65 and older. The last bullet at the bottom of the screen is showing adults who did not have a living will or durable power of attorney but discussed their medical wishes with a family member or a loved one. And we saw about a 10% increase here since the last assessment in 2017. The preventive medicine section is next. This section encompasses vaccination data for Lucas County adults. First, looking at those who received a flu vaccine in the past year. 57% of the population reported receiving one in the past year, with the highest percentage being those 65 and older. The Latino population was at 65% of the total population. Our lowest percentage was those 30 years and younger. Our comparisons are also showing vaccination data. The flu vaccine data has two separate indicators, one for all ages and then one for those 65 and older. Overall, we see an increase in adults receiving these vaccines for both of these age groups. Pneumonia and shingles vaccinations have also increased since the last assessment, but are a little bit lower than the Ohio percentages. Next, we have specific sections for both women and men's health. Both sections include data on preventive exams. For women's health, we look at clinical breast exams, mammograms, and pap smears. Overall, 40% of women had a mammogram in the past year. That's including women of all ages. And then this increased to 58% of those ages 40 and older. All of our indicators here for Lucas County has increased since the last assessment. We also realize that screening recommendations change depending on the recommendations of different organizations. We are following the CDC's guidelines here for these questions within the adult comparisons. For men's health, this slide is looking at digital rectal exams, which is a test which healthcare providers use to check the lower rectum and other internal organs. Overall, 17% of men had this exam in the past year, which did not change too much since the last Lucas County health assessment. Our 50 and older population, due to recommendations, is much larger at 29% of the population. Also, African Americans were most likely to have had a digital rectal exam in the past year in comparison to the white and Latino populations. Our last section falling under the healthcare access section is oral health. First, 64% of adults visited a dentist or dental clinic in the past year, which decreased quite a lot for those with lower incomes. The main reasons adults did not see a dentist was due to cost at 20%, and the top oral health issues that adults reported were pain, difficulty eating and chewing, and oral bleeding. Next, we break down those visiting a dentist in the past year, the same way you have seen previous graphs. The lowest percentage seeing a dentist in the past year were for those with lower incomes, and then highest for higher incomes. Another disparity you will see is the African American population having the lowest percentage visiting a dentist when comparing to white and Latino adults. At the bottom of the slide, you'll see the overall percentage of 64% being slightly lower than our Ohio and US comparison data, and then decreasing slightly since the last 2017 health assessment. The next section that we are covering is health behaviors, which is one of the largest sections in the full health assessment, and you can see all the categories that fall underneath health behaviors. First, we are looking at health status perceptions, which adults report how they perceive their overall health, both mental and physical health. The graph is looking at overall general health being rated as excellent or very good, good, or fair or poor. The lightest color at the very top of the graph is showing fair or poor health. When looking at this indicator, the percentage is much higher in those 65 and older and highest for annual household incomes less than $25,000. Additionally, when comparing African Americans, whites, and Latinos, 25% of African Americans reported their health as fair or poor, which is 10% higher than the Latino population. Our comparison table for health status perceptions is quite larger than some of the past ones that we've reviewed. The second row is showing our trends for those reporting fair or poor health, which has increased a few percentage points since 2017, but overall is lower than where Ohio and the United States stands. Overall, we can see mental health perceptions improving, with those rating their mental health as not good, decreasing in this 2020 assessment. Also, when looking at physical health, we have adults reporting less days that their physical health was not good. Another large section, which is weight status, includes information about nutrition, BMI, and physical activity. 72% of adults were either overweight or obese. This information is calculated by our statistician based on body mass index, or BMI. We asked both height and weight questions on the written survey. Over half of adults were trying to lose weight. And lastly, our comparisons are pretty similar to Ohio and the US data, with Lucas County's obesity percentage 3 percentage points higher than Ohio. The BMI graph is broken into those who fall into normal weight, overweight, and obese categories. The top and the very darkest color that you are seeing is indicating obesity. The highest percentage of those that were obese were lower incomes, and the Latino population at 51%. The Healthy Lucas County Executive Committee asked a new question in this round, asking about park, bike trail, and walking path usage and what would make adults use them more frequently. More accessible and designated safe routes were the top responses. 55% of adults, as you can see in the bottom bullet, engaged in some type of physical activity or exercise for at least 30 minutes, 3 or more days per week. And then as you can see underneath, a fourth were not engaging in any physical activity in the past week. Next, we are looking at consumption of fruits and vegetables as well as sugary and caffeinated beverages. The table breaks this data down into 4 different categories, the first column being 5 or more servings, and the last no servings at all per day. Barriers to consuming fruits and vegetables included too expensive, did not like the taste, and did not know how to prepare. The next section that we will be covering is adult tobacco use, with the first bullet showing current smokers in Lucas County. 15% of adults were considered current smokers. Keep in mind this is just looking at cigarette smoking. Cigarettes are still the top tobacco product, with e-cigarettes and cigars tied for the second most popular. And then our last question is a new perceptions of e-cigarette vapor harm question, which indicates adults perceiving it is most harmful to themselves. 3% reported e-cigarette vapor is not harmful to anyone. The graph on the slide is looking at smoking behaviors for Lucas County adults, with current smokers depicted as that lightest color that you'll see on the graph. 27% of those with lower incomes were current smokers, and then also African Americans were about 5% higher than the general population. The first bullet is looking at those that would support an ordinance to ban smoking in any of the following places. More of the population is supporting some type of ban in any of those categories that are listed than the last assessment, so increases in every category. All of the data points in the comparisons at the bottom of the slide are pretty similar to previous assessments, more trying to quit smoking, which increased by 6% since 2017. Current smokers in Lucas County are also lower than Ohio and United States percentages. Next, we're reviewing alcohol consumption data for Lucas County adults. 60% of adults had at least one alcoholic drink in the past month, and this is defined as a current drinker by the CDC. 22% were binge drinkers, which the CDC defines as 4 or more drinks on occasion for females, and then 5 or more on occasion for males. Towards the bottom of the slide, you will see 5% of adults used a program or service to help with an alcohol problem, and that is both for themselves or a loved one. We ask the reasons why adults are not using a program, with the top response being they had not thought of it. Other responses that you'll see is they did not want to miss work, stigma of seeking services, and fear. As I mentioned, 1 or more days drinking in the past month is defined as a current drinker. This slide is looking at the number of days adults were drinking within the past 30 days, with the lightest meaning no drinks at all in the past month, and the red 3 or more days in the past month. Those most likely to be in that red category of 3 or more days were higher incomes and the white population. Our alcohol consumption comparisons are showing a higher percentage of current drinkers for Lucas County in comparison to Ohio and the US. Same trend for binge drinking and drinking and driving. We do see about a 5% decrease for those that were considered current drinkers than the last 2017 assessment. Next is the drug use section, with 3% of adults reporting being prescribed opioid-based medication and have trouble stopping. As a result of using drugs, adults indicated they or someone in their household experienced any of the following, with the top responses being failed a drug screen and regularly failed to fulfill obligations at work or home. You will see some NAs, which is depicting not available for data for Ohio and the US in our comparison table. The CDC does not ask drug use questions on their national survey, largely because the CDC asks these questions over the phone and they're more of a sensitive nature. We can see more reporting using prescription drugs in the past 6 months in Lucas County when comparing to the previous Lucas County Health Assessment. The first graph that we are looking at underneath drug use is recreational marijuana use in the past 6 months, the highest being 30 years and under at 17%. The next graph that we're looking at is medication misuse in the past 6 months, with the highest percentage of those misusing prescription medication having incomes of less than $25,000, being about 5% higher than the general population. The next section falling under health behaviors is sexual behavior. The first bullet is indicating 63% had sexual intercourse in the past year, and 7% had more than one partner, which you could see in the comparison table below. 9% of adults were forced to have any type of unwanted sexual activity. You can see this increasing with lower incomes and for females. Only 16% of those who reported being forced to have sexual activity actually reported it. The next graph is indicating the number of sexual partners in the past year. The middle area, which is the lightest color, is indicating more than one partner in the past year. This is highest for higher incomes and then the Latino population when comparing to white and African Americans. Our last section falling under health behaviors is mental health. The first bullet showing 5% considered attempting suicide in the past year, with 1% attempting suicide. This has definitely increased since 2017, where we were at 2%, and the numbers have stayed about the same since 2007 in Lucas County. We do not have comparison data here for Ohio or the US, but we do have some additional secondary data within the full report. The second bullet is looking at adults experiencing the following almost every day for 2 weeks or more in a row, with the top responses being not getting enough sleep or rest and having high stress. To finish up the mental health section, this slide is showing what prevented adults from using a program or service for both themselves or a loved one to help with depression, anxiety, or emotional problems. 11% reported they had not thought of it, and 6% did not know how to find a program or had other priorities. You will also see stigma and fear towards the end of the list. Our next section is chronic disease, which encompasses the sections that you see on this slide. First, we will start with cardiovascular health. The first graph is representing those diagnosed with high blood pressure by a doctor or healthcare professional. The highest percentage of those diagnosed were those 65 years and older, those with lower incomes, and African Americans. Next, you'll see the exact same trend for those diagnosed with high blood cholesterol, with the highest percentage in the 65 and older population, lower income, and African Americans. The indicators within the trend summary are showing both high blood pressure and cholesterol increasing since the last assessment, but we also see more people getting their cholesterol checked within the past 5 years than previous assessments. Both heart attack and stroke stayed about the same and are very similar to Ohio and US percentages. Moving on to cancer, with about 12% of adults being diagnosed with some form of cancer in their lifetimes, increasing to 29% of those ages 65 and older. Of those diagnosed with cancer, the top cancers reported by adults were breast cancer, other skin cancers, and prostate cancer. The last bullet is indicating adults who had different types of cancer screenings, with the highest percentage being colorectal cancer screenings in the past 5 years. Moving on to arthritis, 18% of adults were diagnosed with some form of arthritis, increasing with age. You'll see that percentage decreasing from the last assessment in our comparison table below. In 2020, 13% of adults were diagnosed with asthma, which increased since our last assessment and is a bit higher than state and national comparisons. You'll also see a few COPD bullets, with 4% of adults reporting being diagnosed with chronic obstructive pulmonary disease and more than 3/4 reporting receiving treatment for it. 13% of adults were diagnosed with diabetes, and all adults reported receiving treatment for it. You can also see 37% of adults with diabetes rating their health as fair or poor. This graph is breaking down those diagnosed with diabetes, with the highest percentage ages 65 and older, and those with lower incomes. The very last section for chronic disease is covering quality of life. The first graph is looking at adults who reported any type of limiting health problem. Back and neck problems was reported as the top limiting problem for Lucas County adults. The last section of this presentation covers social determinants of health and environmental conditions. According to the CDC, social determinants are conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life outcomes. This section is divided into 5 key areas of social determinants of health throughout the report. The first slide is looking at food insecurity in Lucas County, with 8% of adults choosing between paying bills and buying food, and 5% being worried food would run out. 7% of adults experience more than one of those food insecurity issues in the past year. This slide is looking at adverse childhood experiences, or ACEs as we call them. These adverse experiences are traumatic events that occur in childhood under the age of 18. Some of the options are experiencing violence, abuse, witnessing violence, or having a family member attempt or die by suicide. These ACEs are linked to chronic health problems, mental illness, or substance misuse in adulthood. This question was actually asked in all of our population surveyed in the Lucas County Health Assessment. For the adult ACEs question, we look at those experiencing 4 or more. As you can see, we have the majority experiencing 4 or more who were 30 and younger, and also those with lower incomes. Latinos also had a higher percentage experiencing ACEs than white and African American populations. Next, we had quite a few questions looking at discrimination, which could be based off of skin color, ethnicity, religion, etc. When asked if adults experience feeling emotionally upset as a result of any of those categories, most felt emotionally upset based off of their skin color and ethnicity. Additionally, 17% of adults reported feeling emotional or physical distress as a result of how they were treated based on any of the above categories. We also have questions looking at experiences with healthcare and if adults felt they were treated worse, better than, or the same as other races. This question was broken into African Americans, whites, and Latinos. The highest percentage of those feeling their experiences were worse than other races were the African American population. The white population had the highest percentage reporting their experience was better than those of other races. The last section under social conditions and the last section in the full health assessment is environmental health. One main question asks what is threatening adults' health in the past year, with the top response being bed bugs and mold, both at 8% of the adult population. Thank you for your time and interest in the results of the 2019-2020 Lucas County Community Health Assessment. Please remember to review the additional sections of this presentation that you may be interested in, including the African American and Latino specific sections, the youth and the child data. Of course, you can also check out the full report on Healthy Lucas County's website. Before we finish, I also want to encourage you to fill out a participant feedback survey with more information on the next slide. Here you'll see a link to our participant feedback survey, which is on the SurveyMonkey platform. We ask questions that will help the executive committee move forward with planning for their community health improvement plan, which is the next step of this process. Thank you so much for your time.